Hi everyone, thank you for joining us for the book launch of Mental Health and Collaborative Community Practice, an Australian Perspective. My name is Matthew Bowes. I'm the Oxford Learning Resource Consultant for Higher Education, specifically Health Sciences. In the spirit of reconciliation, Oxford University Press acknowledges the traditional custodians of country throughout Australia and their connections to land, sea and community. We pay our respects to their elders past and present and extend the respect to all Aboriginal and Torres Strait Islander peoples today. This afternoon we're delighted to have 5 of the 6 lead authors with us. Graham Meadows, John Farhall, Ellie Fossey, Fiona McDermott and Sebastian Rosenberg. Over the next 45 minutes they'll introduce the book, highlight key topics and answer any questions you might have. As the session progresses, I ask you please post your questions in the chat box below, and that way we can hopefully get to answer as many of those questions as possible. A friendly reminder to everyone to ensure that the microphone is on mute and your video is switched off. I'll now pass to Deborah, our publishing manager, to start the Q&A panel.
Hi everyone, thanks and welcome to those who are attending to listen to this wonderful virtual book launch. It's the first for Oxford University Press, and I do thank all of the authors for their work on this book. It's been a long time in the making. I think probably the first meeting that I had with Graham Meadows might have been in 2015 or 16. So a very, very long time in the making, and it's come together extremely well. So thank you to all of the authors, not only the ones who are here today, but all of the contributing authors for this fabulous book. So I guess I may as well start with Graham, and certainly as it has been quite a long time between editions, a lot has changed. I just wondered if you could just talk about what changes have been made to the edition, to this new edition, and the reasons why.
Yeah, look, Deborah, thanks for that, and thanks for your companionship and support and that of other members of the OUP team through this time. You know, as you said, it's been a long time, and that actually enabled us to do some things very differently this time around. There's a lot of strengths that we wanted to maintain from the earlier editions, but there are also some things that we wanted to enhance and some new things we wanted to bring in, capturing, as it were, the zeitgeist of the way that that's changed in the last few years. So the book's always been strong on consumer involvement, but we've strengthened that further, including with the nexus of 4 associate editors, and these have come in including as beneficiaries of royalties, and I'm appreciative of OUP's approach to that and some generosity there, I think. So Vrinda, Marinda, Hamilton and Kath have joined us as associate editors with lived experience, also as an extended part of the process, because we wanted to capture some more issues about diversity and address something that I think was not done particularly well in earlier meetings, which was, for instance, the coverage of Indigenous peoples and the prominence that's emerged in relation to, you know, LGBTIQ people, for which, you know, we've had additional input. So Fiona, Pat, Jonathan, Caroline, Harry and Sally joined us then as members of the editorial board to assist that. That's enabled us through time to respond to the developments that have really happened in that time. And, you know, when you think of where we are in 2020 compared to, you know, where we were at the time of the last edition, you know, things like, you know, climate change is huge in the current consciousness, and we've given that much more coverage. You know, I think that we made a fairly early pick that social determinants, issues of equity and inequity and social disadvantage would be an increasingly important flavour in the contemporary dialogue, and I think that was a good pick. I think we picked that right, and I think COVID-19 has only accentuated that. Really, we were although the text was late in development, it wasn't so late that we couldn't at least fold something in about firstly bushfires and then pandemics. So I think that I do think that our engagement with Indigenous peoples, LGBTIQ, very, very much stronger, and others. And I think we've also extended and deepened the connection with recovery-oriented practice, which is so much more of a way of thinking about things. There's quite a few structural changes, which have simplified some aspects of the structure for navigation. Assessment chapter is condensed into one, as with much of the intervention content. And so I think that we have really tried to create a book which, reflects a series of current concerns, and also then hopefully sets a kind of vision for incorporating those into contemporary mental health practice at multiple levels. We've also, I think, in the process of that, created something which is a little bit more internationally accessible, which is part of the reason for the change in title. But it should nonetheless be of core and significant, I think, value to people working in, around, with, or receiving mental health services in Australia.
Thanks, Graham. That's certainly given a really good overview of the book from beginning to end. I think that the next question we have kind of follows on from that, and it's one for Fiona. We sort of talk about there's a lot of scope in this book. It covers a lot of ground. I wonder if you could identify the core sort of threads or themes which unite the book and actually help shape it.
Yes, thanks, Deborah. When we sat down as editors to even think about this new edition in 2016 or thereabouts, we really wanted to start off thinking about what would the architecture of the book look like in this new edition, and sitting down to think about that made us really focus on what was totally unavoidable, and that is the fact that the mental health world is so characterised by such diversity, and Graham has mentioned elements of that we've amplified in the book. But there are not only diversity of stakeholders, policies, practices, but there are many competing understandings of mental health, mental illness. This range of stakeholders, and the number of authors in the book gives some sense of that. There's also an enormous treatment, innovation and ex-innovation. So it's a field in constant flux, and I guess that's partly the reason for needing a fourth edition, I would say. But it does really demonstrate throughout, over time, the sort of emergent systemic responses and adaptiveness within Australia and overseas to mental illness. But starting out at the beginning, we wanted to come to terms with how we could actually think about that, how we could draw some of those threads together into some kind of meaningful mix, rather than just being overwhelmed by the diversity, the complexity of it. And also how to grapple with a book which is a fairly static medium, and we're trying to depict in that somewhat static medium something of the constantly changing mental health world. So what we felt we needed was a sort of conceptual lens, and so part one, in addition to sort of setting the scene in other ways, it offers a conceptual lens through complexity science, in particular the notion of complex adaptive systems. And even the briefest look at the mental health world will see how appropriate it is to try and understand it and trying to grapple with it through that complexity theory as a lens, really. And there's four pillars, if you like, of complexity theory: that the linearity, the non-linearity of the way the world works. We might like to think of it as linear, but in fact, as contributors to the book demonstrate, it's very non-linear. There's always the unexpected and the unpredictable. But it's a world in which there's a lot of feedback, which is a strong element of complexity theory, in which a moving forward, a moving back, a reflection, a retraction and an addition happen constantly, which leads to this sort of emergence of different ways of seeing things, different ways of working, different ways of understanding. And in that emergence, there is the adaptiveness of the way in which actors and structures and people and practices change to adapt to and to manage and to bring to life the issues that need to be worked with. So we thought we have proposed that readers enter the book, as it were, with a complexity theory sort of lens, because we want, we all of us need to be able to sit with the differences and the differences in approaches and in understandings, the contradictions that are often there, the paradoxes and the disagreements that characterise and enrich the mental health world, if you like. So in each part, as Graham has sort of sketched, there are multiple contributors who come from multiple and varied positions with multiple and varied stakes in the outcomes of mental health research, practice, experience. And by thinking of this this ever-moving, fluid world as really a sort of ongoing project, that mental health services and systems constantly adapt and change and are rarely sort of captured in a static sort of a way. So we want people reading and learning from and thinking about the content and the diversity of the content in the book to sort of take it from a complexity theory informed approach, so that well, we found as authors and editors that did help us accommodate to and make sense of some of the richness of the contributions that the book comprises.
Thanks, Fiona. That's very nicely explained. It leads very, very well onto, I was actually having another read of the preface, which I really enjoyed reading when it came in. Certainly the notion that the intention of the text was to present a range of opinions and perspectives, and always with mind, I guess, for those who are working in the interest of those with mental health issues. And certainly I'm very aware that the perspective of consumers and families is very much at the forefront. So this is a question for Ellie. So how is the perspective of consumers and families engaged with in the book? Have we lost Ellie?
We haven't lost Ellie.
Who's Ellie?
Going on video conference for the last 6 months. I still haven't remembered to, so I apologise for that.
That's okay. That happens to me all the time.
I think this book has always engaged with the idea that there are no single or unified perspectives on what we refer to as mental health, what we refer to as mental distress, and even on how we go about the provision of mental health care and support. There are many different perspectives on all of these issues. And, you know, if I reflect on the time that I've had a career in the mental health area, I think one of the most profound changes that has occurred over, dare I say, 30 or so years, has been the enormous shift in awareness about the value and the importance and the place that understanding that comes from direct experience, lived experience, and the expertise that develops over time from that lived experience, whether that be experience as a consumer, as somebody who makes use of services, or it be the experience of someone who lives and supports someone else who's got a lived experience. Those perspectives have become much, much more central to the way that mental health services think, as they should have done. There is probably a way to go, but I nevertheless think that that's been a really profound shift over the last few decades. And so whilst the earlier editions of the book certainly had contributions in them written by consumers, written by people with family experiences, this has been amplified substantially in the current edition. And as Graham said, we have 4 associate editors who bring expertise grounded in lived experience to the book. We've also a much wider team of authors with lived experiences as consumers and with family experiences of mental health issues. So hopefully for the primary audience, the primary groups of people for whom the book was written, I guess, so the current workforce and the upcoming workforce in the mental health field, there is greater opportunity from the book to grasp a sense of the value of those particular perspectives. But I think also I would hope that the book might also engage with people who are trying to navigate mental health care and support, who are trying to understand the systems of services and care and support that are available, and so that in some ways the book may also engage with consumers and with families in that sense too. And I certainly hope, knowing how bewildering the system can be, that the book might help to contribute to that understanding as well.
Thanks, Ellie. So the next question we have does actually refer to systems. I think it's kind of around about midway, I think, within the process of writing this book. Graham, you were keen to sort of shift the book from the DSM model to the new ICD model that was a classificatory system used internationally. It has actually shaped the structure of the book in the way that each of the parts and the chapters are structured, which I think is a really good thing. But I just wondered, John has arrived just in time for his question. Hi, John.
Hi. Sorry, I had technical problems, but I'm glad my question wasn't the first one.
No, you've come in exactly at the right time. So otherwise, your backstop was going to be Graham, but since you're here, would you like to ask the question about why the shift to ICD?
Yeah. Well, it is actually a significant change for us as editors and for our author contributors. And I think it's, in essence, ICD is a better fit with the book. So maybe if I give a little bit of context. So ICD, you probably know, is a classification of all health conditions. It's not just mental health disorders. It's auspiced by the World Health Organization. It was originally developed for tracking population health and comparisons across countries and so on. And it's adopted by health systems internationally. DSM is a classification of mental disorders only, and it was developed and published by the American Psychiatric Association. So why have we decided to move from DSM to ICD as the primary reference to disease classification or disorder classification in this? I think probably the most important reason is that the ICD system better reflects this book's orientation to the world of practice. It's more relevant to practitioners and therefore to students and trainees who want to become practitioners because ICD is the classificatory system used in Australia and worldwide for health service and for government systems. So if you're working in a mental health service, for example, the diagnoses are recorded in ICD language and classification numbers, not DSM. The second really important reason is one about accessibility. Our book is intended to be used by anyone who's interested, and we have many voices in it, including consumers and carers, as Ellie was just saying, more extensive, and some of the readership will be consumers and carers and the general public. Having a system that is more accessible and more generally known and relates to the health system makes a lot of sense. The ICD criteria are a bit more descriptive and intended to be used by members of the, to be read and used by members of the public as well as, practitioners. It's arguably a simpler system than the DSM one, which goes into more detail of criteria and more technical levels of criteria. So for the breadth of readership, we don't, and for the purpose of the book, we don't need the detail of the criteria that is in some DSM disorder classifications. Another really important accessibility thing is that ICD is freely available on the web, so anyone can look it up. DSM is not freely available. It's marketed by the American Psychiatric Association, it's copyrighted by them, and they protect their intellectual property by making you pay to see it. These are the main reasons why we thought we'd make the big change to ICD. The second question there about has it changed the content included in the book? People who are familiar with the third edition will see in this that both systems are referred to. So occasionally ICD would be referred to in the third edition, but in the fourth edition you're much more likely to see reference to both systems. And in particular in the disorder chapters, where disorders are being presented, an acknowledgement is made of similarities and differences to DSM when the ICD diagnosis is being presented. Much research is actually presented in journal papers using DSM diagnoses. So one of the reasons you'll still see DSM diagnoses referred to is that the research that our authors are reporting was done utilising those criteria. And so for accuracy, our readers need to know which system that research was oriented around. That may sound like, oh God, that's going to be very complex understanding the material if, some of the research that's presented is in DSM language and groups and others not. The reality is the ICD mental disorders and the DSM mental disorders are not all that different. There's a little bit of difference in language. There's a few difference in actual classifications, but the American APA and the WHO have been at pains for a few decades now to make links and to be as similar as possible in the presentation and the language in their systems. So although you'll see both referred to, we stick with ICD as the primary system we refer to for the reasons that I was saying before. But you will still see appropriate references to DSM for clarity. So in essence, that's
Thanks, John. That's a very clear explanation. We've got one last question for the Seb, actually. So Seb, the part that you primarily coordinated had sections on mental health systems and in each state and territory. Such a wide area to cover, and certainly the whole book is a gathering together of such a wealth of information. And yeah, would you like to talk through what you think readers will learn about mental health systems in each state and territory?
Thanks, Deborah, and thanks to you and OUP for your support, and thanks to Graham in particular for the opportunity to join the editorial board for this edition. Yes, I'm the new boy on the editorial board. I'm what qualifies as the youth policy of the editorial board. So you know you're in trouble when you've got a grey head, a grey bearded chap who's the youth policy. Look, I guess, as an overriding thing, when we started, we were sort of trying to think about, if you were starting to work or to study or to try to understand the mental health system, what would you need to know? And I remember talking to a psychiatrist friend of mine who was sort of lamenting the fact that there were some specialists who were fighting over a piece of gut. Who owned that piece of gut and the right to claim the Medicare item and to operate on and what have you. And, mental health's just not like that. And I think what you find, as people have talked about, is the breadth. There is such a broad range of issues so we're dealing with things like which are fairly common, like anxiety and depression, all the way through to things which are more low prevalence, like schizophrenia. You're dealing also then with issues to do with clinical care through to issues about social determinants, as Graham talked about. So you're interested in things like employment and social inclusion and housing and other matters. And these are issues which we're attempting to deal with in looking at the way different systems approach that breadth of problem. So I guess what you find, in a nutshell, when you say what do readers learn about mental health systems, is that, I guess, again, unlike the specialist with the gut, things are surprisingly different depending on where you live. And so it matters whether you are in New South Wales or in Victoria. It matters whether you are in a city or a town or a farm. It matters a lot as to what sort of care you get, what you can expect, who you might see, what it might cost, and so on. And I think that this is a really critical matter. So it was really great to be able to get a group of authors together to be able to describe those differences. So you'll see in the book that some of them are past mental health commissioners from those jurisdictions. Some of them are current mental health commissioners. Others are prominent people from the local mental health system. There's academics. There's a range of views where they are attempting to try to describe key characteristics of the mental health systems where they live and what makes them unique. And it is those differences which means that, it's not necessarily simple for us to talk about just a mental health system. There is, in fact, as Fiona was saying, a lot of complexity. And hopefully this part of the book contributes to bringing that out. I think one of the other things that I would say about, in answer to the question, is I think the book hopefully also describes some of the struggles that we all have, either as workers in the system or as policymakers or what have you, in attempting to try to actually identify the extent to which we're really helping people with mental illness get better. So there are limitations around data and around issues to do with outcomes, particularly as you move away from healthcare, mental health care outcomes, to some of those other issues which are important to people, like social determinants type issues, employment and housing and education and so on. And the book, again, I think, goes a long way to describing what it is possible currently to know about those circumstances and what isn't. And I think that, just to finish, what is really good about this book is that it I think, emphasises that critical word which really underpinned mental health reforms back in the late 80s and early 90s as asylums were closed and so on. And that key word really was community. And it's I think sort of it's pleasing and congruent that the recent report of the Productivity Commission into mental health has gone back to that principle as saying that what's really important in mental health is access to good community collaborative practice. So hopefully this book will highlight how that can occur. Thanks.
Unmute. It's a really good good point to end this part of the sort of panel questions. So and now we're sort of inviting those who have joined us to use the chat box to ask any questions. I think it's kind of strange for a virtual book launch. I was around for the first edition book launch, and it was certainly a very different event. It was at readings, and there was a lot of glasses of champagne. So I guess it's probably appropriate to toast a virtual toast at an official launch. I dare say that there will be opportunities that you'll probably have loads of virtual launches or loads of real launches in the months to come. But yeah, any questions from the audience would be welcome. I've got a couple that have come through, and of course I have questions of my own. But I've got a feeling that Seb might have answered a couple of mine. But I do have one for him. Graham mentioned at the start that there was time to include, I guess, information about some of the unprecedented events that we've seen this year and last year in the bushfires, the environment generally, and the pandemic. Seb, would you like to talk about just how those aspects have been integrated into the text?
Well, look, I might actually let Graham start off, if that's all right.
Okay, yeah, sure.
Okay, thanks. Look, I think that we approached that in a sense not from writing, one big chapter about bushfires or about pandemics. We approached it by dropping a number of extra pieces in along the way. The bushfires prompted us to think about disaster preparedness and strengthen up a bit of coverage on disaster psychology more broadly. And the advent of COVID-19 prompted us to put in some pieces about, a bit about the history of pandemics, because actually many generations of humans would have experienced one or two pandemics in their lifetime. You look back to the 19th century and there were recurrent cholera pandemics. But of course this current one has some very strong and particular impacts, which actually then connected very well with the existing social determinants contents and provided a lot of cross-referencing and buttressing. So I think that some of it was about writing some new content, which we sort of wove through like the proverbial, as best we could, like Brighton through a stick of rock. And some of it was then also enhancing cross-references to material that we'd already put in, because in a sense we had a sense that of the sort of necessary understandings and underpinnings. So I think there was a lot of other material in the book that served very well, and in a sense we just needed to bring attention to it and in some measure employ, cross-reference some of that material to at least give something in the way of, I think, useful coverage of the issues.
And to that, if I can just add, Deborah, I point to the chapter in particular that was, or the section of the book that was prepared by Susie Burke in relation to climate change, which was a new issue for this edition. I was delighted that Susie was able to contribute that chapter, because I think it shows very clearly the interdependence between individual and community mental health and the climate in which which surrounds them. And I think that these issues are becoming much more redolent and well understood, and stimulation for action and thought as we think about the design of services and systems and mental health promotion and prevention going forward. So I think that chapter in particular is a really important addition to this part of the book.
Yes, definitely.
Thank you. While we're still waiting for some questions to come through, there was another one that we thought we might just ask Graham about. So who do you, in terms of the audience for this book? Now, I think one of its strengths has been, and in previous editions, and even more so now, is its interdisciplinary nature. But who do you think will benefit most from reading and using this new book?
I think one can think about that. Thanks, Deborah. I think one can think about that in terms of probably three dimensions: courses, practitioners, and international. And I think there's a very wide range of either multidisciplinary or monodisciplinary courses that could benefit from this. I think that in social work, occupational therapy, and other allied health disciplines, I think the psychology courses that are very service-oriented might take interest in it. It'll be interesting to see what designers of medical education think, because I actually think that our coverage of mental health care issues overall is much broader and potentially more thorough. I also think there's a the third edition has been recommended for psychiatrists in training here in Australia, and I suspect that the fourth edition may well be such that it becomes hopefully a must-read for psychiatrists in training, and that in turn really helps potentially get purchase on some of the key members of the team in terms of shifting multidisciplinary practice. It is also then used by practitioners, I think reflected by a sort of constant steady flow of purchases through the year, rather than the sort of bulk with award courses or blocks with award courses. And I think that will continue to be the case. I think with the third edition, I've not uncommonly had the experience of walking into senior managers or senior clinicians' offices, and there is one book on the shelf, and it's our book. And I think that it does potentially have a very important place. I think it's useful for managers, some of whom have moved around between different positions and who need a quick get across the service system. I remember, if I think back to the third edition, but the first edition was launched by Angela Jurovic, who found it enormously useful moving from other public service roles into being Director of Mental Health in Victoria. So I think it can be useful at all of those levels. And I would also highlight that I do think we've made a bit of an effort to internationalise it. I mean, for instance, a lot of the stuff work on designing mental health care is grounded in the Lancet Commission on Global Mental Health and the UN Sustainable Development Goals, which will be useful for Australian readers to help them better understand the international context, but also potentially provides a different source of connection to international readers. So I think that this edition should continue to be useful and extended be useful to across courses, undergraduate, postgraduate, across practitioners at different levels, and also with a little bit more appeal potentially to international readers.
Thanks, Graham. I get one other question I had, which I don't think I've had the chance to ask any of you, is what did you enjoy about the process? It's a very was laborious and a lot of hard work and a lot of wonderful contributions, and it certainly was I would say it was probably a labour of love. So what kept you going? What do you hope ultimately that the book will achieve? you want to start off, Graham?
Well, look, I mean, I think this, it was wonderful, of course, to welcome, Seb and Brenda and the others, and Brenda sort of, ceased to be as active later on, but Seb was a wonderful contributor, and I feel that sort of freshening up of the team really helped. I think that ultimately the connection and the sense that we were providing a channel for these different voices and the sense of the greater inclusion through the associate editors and the lived experience role and through the other constituencies, and ultimately a sense, and I think probably from my side, I think, as we talked about, some building sense that I think some of the judgments that we made several years out were good judgments in relation to how the book has shaped up, and that in a sense we had correctly read that, reasonably correctly read the rooms, such that as it comes out, it's a timely contribution and I think useful and fitted to the times, and hopefully quite a while forward. John's alluded to the connection with the accessibility of ICD-11. I think the fact that DSM is as John's alluded to, behind an American Psychiatric Association publication firewall, so you cannot access it as a consumer, is absolutely anathema to contemporary mental health practice and should just result in it being completely outlawed for clinical use. But that's a bit of an extreme position. I think our nudge in the direction and our flow forward to ICD-11, which isn't there yet, but still should be, still scheduled for adoption in 2022. So for most of the working careers of people who are starting award courses now, it's going to be the dominant system. So I think that vision of a sense of a book that encouraged mental health care, that was more accessible, that was more empowering, that was more positively engaging with consumers in the way that we were, in a sense, walking the talk of that in our relationship with the associate editors. Plus, of course, the wonderful stewardship, Deborah, of yourself and other members of the OUP team. It's been a blast. We're delighted to see it out there, I'm sure.
That's very, very kind of you, Graham. Well, here I've got a couple of very lovely comments. One from Genevieve Pepin saying we have used earlier editions with our OT students and they enjoyed the broader perspective of mental health that made them think about where they fit and what their contribution to mental health practice can be. It opened their interdisciplinary mind, looking forward to using this new edition. So that's a very nice summary, I think, of the intention of the book. Another one from Tracy Parnell, an important text. Congratulations to all for this new edition and for the interdisciplinary approach and for including the consumer voice. Thank you all. We are also looking forward to including this as part of our course. So that's a couple of endorsements. Does anyone else have anything? I guess we're coming to a close of our allotted time. Any other comments about what you got out of the process of writing and editing, and what you hope the book will achieve fundamentally?
Well, I'll just say that I think, just to add to the thing about consumers, one of the other issues for me that I found really good was to also include a significant chapter about mental health carers. And this is, again, an evolution which happened since the third edition, really, where the rights of carers have been much better understood and so on. And I think that that's been a really good addition for this part of the book. But more broadly, I guess, I'm always stunned by the fact that, mental health and mental illness is ubiquitous. Every family is touched one way or another by issues to do with mental illness and mental health. And there are lots of books about well-being and sort of things like that, but there's really not a lot of solid, useful, accessible information about mental health and the reality of services and care and illness and treatment and so on. So I'm hoping this book will be a really important bit of, I suppose, infrastructure to help people right across the community.
Thanks, Seb. Well, Ellie, were you trying to come in and say a few words, or no?
I was just going to comment that for me, in many ways, the best part of the experience of the most recent book is absolutely in the title. It's in the collaborative practice, in the being an editor and working with associate editors, working with the many authors we've had involved in the book, has been a collaborative experience, and one that I've really valued. And apart from that, I will just say thank you to the people who wrote the feedback in the chat, both of whom are occupational therapists. So,
well, that brings us precisely to our 2:45. Once again, I would like to thank Graham, Ellie, Seb, John, Fiona, Brenda, and everybody, the 129 authors who worked on this book. It's been an amazing achievement, and I think it's an absolutely wonderful piece of work. And I wish it every success, and thank you enormously from on behalf of Oxford University Press. Thank you to everyone who's come along to this virtual launch. I would raise a glass of champagne, but all I have is a glass of water, I'm afraid. So there you are. Here's to you.
I'll raise a glass of water to that as well, Deborah. I'd just also like to thank our authors for their time this afternoon and their valuable insights. And scanning through the participant list, there's a lot of people on there I've already been in contact with, and I'll be sure to touch base in the coming days. And if there are any further questions that do come through, please feel free to send them to the email address that's on the screen. And thank you to everyone, and enjoy the rest of your day.
Thank you.
Thank you.
Thanks, everybody.
Thank you, everyone.
Well done.
Bye. Well done.